Radial head subluxation. Subluxation of the radial head, facilitated by the weakness of the immature annular ligament, causing the radius to slip out of the annular ligament, and the annular ligament becomes entrapped within the humeroradial joint. This is another ligament. This is radial head. Here radial head is slipped. Here another ligament is entrapped between radiohumeral joint. Here is radial head subluxation. The most common etiology of radial head subluxation is traumatic. Sudden axial flexion of the pronated and extended forearm. This is pronated and extended forearm. Here someone is pulling this. This is axial traction. Typical activities. Adult quickly pulls up a falling child by the hand, swings a child by the hands, or drags a child by the arm. This will pull the radial head out of the annular ligament. This is known as radial head subluxation. Clinical features. Child holds the arm with the elbow extended or slightly flexed and pronated. Patient will particularly resist supination as it causes significant movement of the head and will be guarded as general. Pain aggravated by movement, reduced range of movement with limited extension and flexion, no swelling. Diagnosis is clinical. Here is a kid. His arm is slightly flexed and pronated. Treatment. Closed manual reduction. Neither anesthesia nor sedation is required. Apply pressure to the radial head and perform one of the following maneuvers. Hyperpronation maneuver. Hyperpronate the forearm with the elbow extended or flexed at 90 degrees. Supination flexion maneuver. Supinate the forearm, then immediately flex the elbow. A pop or click may be felt or heard. Leave the room, ensuring there are toys for the child to play with, and reassess after 10 to 30 minutes. Following successful reduction, the child should have full pain-free range of motion. Post-reduction care, neither follow-up nor modifications to normal activity are required. Hyperpronation maneuver for reduction of radial head subluxation. Step 1. The child's arm is supported at the elbow and wrist, with the examiner's thumb exerting a moderate pressure over radial head. Step 2. The forearm is hyperpronated. A click may be felt as the ligament moves over the radial head. This is the other maneuver, supination flexion maneuver. Supinate the forearm, then immediately flex the elbow. Here the arm is supinated, then it is immediately flexed. In case of recurrent subluxations, apply a posterior long arm supinant with the forearm supinated and the elbow at 90 degrees. Thank you.